Great. Okay, so that's the recording started. So thanks everyone for joining us. My name is Tim East. I'm the Digital Navigator at Yorkshire and Humber Academic Health Science Network. Welcome to this session that's hosted by Yorkshire and Humber Academic Health Science Network. It's part of Leeds Digital Festival this year, and there's the hashtag there if you want to hashtag any of the content discussion points on this session. In terms of housekeeping, so we'll run through the panel members. So we've got a star-studded lineup today of our panels. So just for housekeeping, if you can keep yourself on mute for the time being, if you want to interject on any discussion points, then or if you have any questions or any points, if you want to put that into the chat, and we'll keep an eye on that. There's a section for a section for questions and answers. So I hope you'll find this panel discussion enlightening and some interesting topics coming out. So I'll move the slide on and we'll introduce the panel members. So as myself, as I say, my name's Tim East. I'm the Digital Navigator at Yorkshire and Humber Academic Health Science Network. I've got a background in digital healthcare. Worked on a number of sort of online platforms over the last 15 years, delivering innovation into the NHS. My current role is Digital Navigator, so we support innovators navigate the NHS. So that's from startup all the way through to mature innovators with products and services into the NHS. I also head up our accelerator program, which is called Propel, which had a net zero flavour. I'll be honest with you, I'm not an expert on climate change. I'm probably sort of general Joe Public in terms of knowledge, etc. So that's a little bit about me. I'll hand over to Frank Swinton. Do you want to give us a couple of minutes in terms of your role and what you do, Frank?
Yeah, thanks, Tim. Good morning, everybody. My name's Frank Swinton. I juggle two jobs. I'm a hospital doctor at Airedale Hospital here in West Yorkshire, where I'm a consultant anaesthetist. But I've been involved really thinking explicitly about the relationship between healthcare and climate change since about 2008. And in 2017, I took a sabbatical and did a master's in leadership and sustainability. And in the fallout of that, for the last couple of years, I've been the climate change lead at the West Yorkshire Healthcare Partnership, which is the ICS in West Yorkshire, the integrated care system. So for those that might not know, in brief, that's the administrative function that sits between the money that comes from the central government in the UK, in England, and the hospitals and healthcare providers, pharmacists, dentists, etc. And so I'm responsible for trying to reduce our impact on the environment and make sure that we're prepared for the worst of the effects that do come to West Yorkshire. Sorry, Tim, I should perhaps also say that I have a bit of an interest in active travel in the style of a DOI. I'm a trustee at an active travel charity. And I've been heavily involved with the Academic Health Science Network, and particularly with the Propel programme that Tim spoke about. And we're trying to ensure that environmental considerations are woven in through all of the startups and the support that the Academic Health Science Network provides.
That's great. Thanks, Frank. And next we've got Pete, who's the National Network Environmental Sustainability Lead. Is that right, Pete?
I'm the net zero lead for the HSN network. So yeah, for those that don't know, the HSNs, there's 15 up and down the country. We've got kind of an overarching HSN network that just helps bring us all together. So I'm now leading the HSN Network's net zero strategy. So thank you for the invite. Good to be part of this panel discussion. Tim, don't worry, we'll get you well up to speed so that you're more than Joe Public knowledgeable by the end of this call. Just a little bit about me really briefly. I've been in this post only a few weeks. Before that, I was working at the Yorkshire and Humber HSN for 4 years, working with Tim, working with some of the brilliant panellists that we've got on today. Prior to that as well, I worked in the NHS for 10 years. Before that, I was about 10 years in the local authority, public sector. And then I also had a couple of years working for the Yorkshire Wildlife Trust, managing Spare Nature Reserve, which is one of the most sensitive sites in the country ecologically. And as you can imagine, gives you a good flavour into the reason why we need to look after this planet. So I'm really keen. I think innovation, I think the work of the NHS and everyone on this call, we can really chip in and make good inroads into this. So looking forward to the panel discussion, Tim.
Okay, that's great. Thanks, Pete. And next up, we've got Jamie. Are you on the call, Jamie, from Dickinson?
I am. Good morning, everybody. Great to speak to you all. I am a partner in the commercial health team at Dickinson. For those of you that don't know us, we are a international law firm with offices in Leeds and various other locations around the country. We have a very large practice working for healthcare clients, and that includes everybody from large NHS organisations, commissioners, hospitals, academic health science networks. We partner on the Propel programme, for example, but also with a lot of health tech innovators and helping those sort of businesses to sell into the NHS. And it's a very interesting area to work in because often the problem is not innovation. There's tons of that out there, we know. The problem is how the NHS adopts that innovation. And so a lot of what we try and do on the legal side is to try and support that and help with adoption. As a firm, we've been interested in the net zero agenda for some time, interestingly led by other bits of our business, in particular the marine colleagues who have been working on this decarbonisation in shipping in that sector for a long time. It's been interesting the way that healthcare, I think, has played a bit of catch up to other sectors in some ways, but is catching up fast now, and the Greener NHS programme is a big part of that. So we are putting in place our own carbon reduction plans, as you would expect, working with the Zero Carbon Research Institute at Liverpool University, and very keen to support this agenda. So delighted to be on the call.
That's great, Jamie. And next up, we've got Tom, who's Head of Sales and Lead for Sustainability at Patient Knows Best.
Yeah, hi everyone. So it's a bit of a strange combination being part of a sales team, but also a lead for sustainability. But it's working quite well as a bit of a pairing up. So we at Patients Know Best, we were fortunate enough to be part of the Why Propel Net Zero programme. So looking at not only what can we do and how we're delivering benefits to patients, to healthcare professionals, reducing the financial cost associated with the delivery of care, but also looking at the impact that we can have in terms of reducing that environmental footprint. And just a quick kind of 30 seconds on Patients Know Best. So we're the largest patient-held record patient engagement platform across Europe, with just over 2.1 million registered patients accessing the platform. The idea behind PKB is quite simple. How can we empower patients to have access to their own information? How can we support patients in recording information about their health and well-being and sharing that with their healthcare professionals? How can we ensure that patients have access to information they need to understand their care, understand their condition, and self-manage and self-care? And also, how can we enable and empower patients with digital tools to interact with their healthcare providers in a digital way, moving away from the need for face-to-face interactions being the default way of patients and healthcare professionals interacting. I think that was about 30 seconds anyway, as a summary.
Yeah, you've been practicing your 30-second elevator pitch, so well done there, Tom. And then finally, but not least, we've got Eva, who's the Managing Director at Dignio UK.
Thank you, Tim. Thank you for having me on the panel. Dignio are originally a Norwegian company. My background is in clinical trials prior to Dignio and supporting medtech companies developing innovation. Dignio came to the UK looking very much onto a familiar landscape of a publicly funded healthcare system. And our main mission is to keep people away from hospital, but to stop them from turning up at the A&E and turning up and occupying a hospital bed unless it's absolutely necessary. And we firmly believe that empowering patients to understand what makes them better, what makes them worse, is what allows safe care to be delivered remotely, and to look at optimizing how care is delivered by whom and where. And that has an immediate carbon footprint impact. We were also fortunate enough to be part of the Propel Net Zero accelerator, and we're very grateful for the participation and education we derived from that. Very much looking forward to the discussion here today.
That's great. Thanks, Eva. Okay, so in terms of the next slide, I thought this really sort of highlighted the climate crisis this year. And I know up to this point, really, you know, the climate crisis has been seen from a distance, really, something that's on the horizon. And that at some point we'll get round to it, but we've got a lot more other pressing priorities. I think the COP26 conference in Glasgow obviously was an incubator to start that conversation and move things forward. But from you know, general public perspective, you know, this diagram, this sort of slide demonstrating this summer when there was projections on temperature impacted by climate change for 2050, and you know, the consequence this year of actually the temperatures matching that that sort of projection, but happening in 2022. And I know personally it really brought it to the forefront, the climate agenda, and it needs pushing up the agenda, and it's going to impact you know, number of the whole raft of society. So I think that really sort of brought it home, and I think you know, from a general public perspective, it's starting to put it up the sort of agenda for things that we need to address. So what does that mean? I'm just going to drop the slide out, and like I say, if panel members want to chip in, that's fine, that's good. But we'll start off with Pete. Now, Pete, you've obviously worked closely with the NHS, and from a sort of strategic perspective. So can you bring us up to date in terms of the current NHS policies with the NHS Green Agenda? So what are they focused on, and what are they at the moment?
Yeah, of course I can. Yeah, I mean, just before I do that, again, just to thank people for taking the time to join, really. I mean, I can see we've got about 45 people on this call. It'll get recorded. I'm hoping we'll share some on social media. But I think the first thing that we need people to do is to care, to want to look at this topic. You know, it's very daunting, like the map that you've just shown, Tim. And in fact, I would urge people to go and have a look at some other resources as well. There's a video that I often use and watch. It's called The Tipping Point by George Monbiot. There's lots of other ones, but and Richard Hickson. I mean, Jamie, you just mentioned about the oceans. I've spent a lot of time listening to Richard Hickson's ocean healthcare presentation, and we've really got to just let it sink in for a little bit, just how serious this problem is, and you know, to drive the action that we need. But thank you for joining, and I say thank you for caring and wanting to look at this topic. In terms of the NHS priorities, I mean, let's start with a target or two. So as a UK government, we've said the UK needs to be net zero by 2050. The NHS have said that they want to be net zero for scope 1 and 2 emissions, so the emissions that they directly control, by 2040. And for those emissions that they don't directly control, by 2045. Now, I had to kind of re-Google those stats, even though I look at them on a daily basis, just because they don't always sink in. But the reason as well is that I had a brilliant quote from someone that said, saying that you're going to be net zero by 2050 or even 2040 is like saying that you're going to stop smoking in 15 years' time. You know, the damage is probably already been done, and in fact it has. So, whilst those targets are useful, I think what we really need to cement in people's minds is today is the day that we need action. And it's the same with the scope 1 and 2 emissions. Again, I've been doing a lot of sort of work on this recently, but scope 1 and 2, I'll come into this in a bit later on for those that don't fully understand this. But you know, the things within your control. But the biggest area of emissions for anyone are your supply chains in scope 3. Now, the statistic that floats around is that can be anywhere from 60 to 95% of a company's carbon emissions are sat within the scope 3 categories. For the NHS, actually, that's 75%. So it's 25% is what we control in scope 1 and 2, but 75% is in the supply chain and all the people that work. So the people on this call, the innovators that are looking to help contribute, actually, this is where we do need you to care and to want to start looking at things. So there's a few targets floating around and they're useful. In terms of priorities, Tim, yeah, I mean, there's a number of areas. And again, if you haven't checked it out, do have a look at the Greener NHS website with the net zero strategy. It's fairly easy to sort of digest. There's a couple of nice graphs in there. But, you know, areas obviously like the estates and infrastructure is a big area because, you know, we know that gives off a lot of emissions. The hospitals within that are a big player. And then you've got things like travel and transport, you've got medicines, anaesthetic gases, which I'm sure Frank might touch on later on, inhalers, models of care, which Eva and Tom will probably talk about, because again, what they're doing is trying to change those models of care by being digital. Got things around like workforce and leadership. So lots of areas really. Again, it's, you know, there's often people prioritizing which to go after, and then that's right. But I think every little helps. I mean, for example, patient travel and staff travel in theory is scope 3, it's further down the line. But actually, why wouldn't we want to be influencing that now? There's some quick wins to be had. Again, forget about the carbon impact. You know, I've been lucky. I mean, I've had to travel today to Leeds, but I've done very little travelling since COVID. You know, COVID's forced the hand, but absolutely, it's the right thing to do to not travel. And it's the right thing to do to not travel for a range of reasons, not just from a carbon benefit, but again, like from the and Richard Hickson talks about this, the waste rubber that comes off tires that ends up in the oceans, that destroys our oceans. I mean, the air pollution that's absolutely killing people. You know, the stats are there. This isn't me sort of being over dramatic. You know, you don't have to look at British Heart Foundation, British Lung Foundation, a whole range of people. You know, respiratory disease, cardiovascular disease is killing people today. You know, and a big area of that will be air pollution related. Mm-hmm. So yeah, there's lots of things that we can do. There's lots of areas. And as I said, we just need to go after a bit of everything. We need to be forward thinking. We need to be innovative. And really, it'd be good, obviously, to hear today from maybe some questions from the audience, just what areas you're working in so that we can get a feel. But I'll stop there, Tim, and I'll let other people come in. So I didn't want to sort of get too much on a soapbox, even though it's quite easy not to or want to do that.
It's an interesting point about the, you know, reducing your travel. You know, and there's a question of, you know, pre-COVID, would you have managed to get a call organised like this with that many people on the call? Whereas has COVID been an incubator to make it more achievable? So I'll bring Frank in there because Frank's close, obviously working within the system, the NHS, and one of the key areas, which is, I can't pronounce it, anaesthetists area with the gas. So Frank, what's your take on this from an NHS, but also a clinician perspective?
Yeah, thanks, Tim. So I think I just wanted to follow up, if I may, briefly on Pete's comment about air pollution. I've got some stats at my fingertips. So about 4 or 5% of UK road traffic is on NHS business, 1 vehicle in 20, and about 35 to 40,000 people in England die prematurely every year due to poor air quality, air pollution. So that is a very, very direct, measurable cost in human life of the healthcare that we're providing. You know, that's the hospitals and doctors and nurses are killing people directly. And that's a really, really uncomfortable truth for people who have committed their lives to doing no harm. And I spend some of my time encouraging people to really think about that and reflect on that, because it really strikes to the heart of people's morals and values And as I said, it's very uncomfortable. So to answer your question, what I see is increasingly everybody agrees that climate change is a massive problem. I see that in the administration of the NHS, and I see it on the shop floor. I see it amongst the doctors and nurses and physios and the admin staff daily. I think that there's trouble on several fronts. One is that there's a danger that people feel that they are responsible for all of the problem, and I don't think that that's true. And I don't think that it's within the gift of individuals to solve all the problems. I think that the system as a whole has to take responsibility and set the direction of travel. And I accept, of course, that the system is the people, but there are still plenty of perverse incentives. I think that it is no longer taboo to talk about the healthcare impacts, the climate change impacts of healthcare in a way that it was even 3 or 4 years ago. I think that one of the really big problems is that until now, and that frightening weather map, climate change, and somebody alluded to this, might have been you, Tim, but climate change has been something that we'll get to tomorrow. It's going to affect somebody else somewhere else in another time, and that's not true. Climate change is here today in West Yorkshire.
Mm-hmm. And that links. Sorry, go on.
No, go ahead.
I was going to say that links nicely in the work that you've done from Integrated Care Board side and your climate agenda.
Yeah, so we're trying to engage everybody. Hence the All Hands In campaign. So if people want to have a look at that, allhandsin.co.uk. I think that because the climate change team is really tiny, we've been clear from the get-go that we can only be an agitator. We can only be a stone in the shoe of the system. We can't be a delivery function. And in fact, a delivery function for climate change is a bit of a nonsense, because it has to be everybody's responsibility. So I think that's one of the issues that I face, is getting climate change really onto the agenda, when around the NHS and social care, everything's on fire. We're 10% of jobs are vacant. Another 10% of people are on long-term sickness. The money is dwindling year on year, and demand keeps climbing. I'm making the statistics up a little bit, but it's of that order. And therefore, facilitating space where people, particularly senior leadership, can give some consideration to the long-term important stuff, accepting it's no longer long-term, is a constant battle.
And how do you, so you've obviously got your sort of agenda in terms of sharing awareness of the climate change within the system. You mentioned obviously the systems are busy and there's other priorities. So how do you see this priority sort of being at the forefront of people's minds? Are you sort of seeing a sea change of more acceptance and people thinking about how they can support your programme?
Yeah, I absolutely am. I think the evidence is overwhelming that the public, our citizens, expect the NHS and social care to behave in environmentally friendly ways. Increasingly, it is, as I said, on the agenda. But I think that getting everybody to understand that it's their responsibility and do things differently is really difficult when there is so little currently, that it feels like there's so little wriggle room within the system. So for instance, finding money to buy new light fittings, even though you know that they'll pay for themselves within 2 years and then save you money, it becomes increasingly difficult. We've got billions of pounds of maintenance backlog. And so I think we need to be more innovative about, well, if we were to do X, then not only would it make the staff's lives easier, would it reduce inequalities in society, would it improve patients' health, but it will also take a chunk off your maintenance backlog and save you revenue costs going forwards. And I think solutions that are multi-dimensional like that are likely to be the ones that increasingly will be snapped up. I think just before I move on, Tim, if I may, I think it's really important that the other thing that we don't lose track of is that this is not just a carbon problem. Carbon reduction, carbon net zero is a very important part of moving towards sustainability, but it cannot be allowed to be the whole game, because that is insufficient.
Yes.
You know, we need to think about biodiversity, we need to think about ocean acidification, we need to think about social sustainability and community inequality as well, because otherwise it's all still going to unravel. The carbon metrics tend to be easier, which I think is why we sort of default towards them. I'm definitely guilty of it, but it's really important that we don't lose track of that.
Yeah, I get a sense, especially when there's some clear objectives around that, you know, people just focus on that. Pete, you've got your hand up.
No, thanks. I was just going to give some thoughts as well to that question and join on to Frank's quickly. But you know, in terms of what we need to do, again, there was an interesting quote from a report that said people now understand that climate change is real. What people don't understand, clearly enough, is the consequences of climate change. And so I think we've got to keep banging home that message. And again, that's a daily thing, even for someone like myself, who you'd argue is fairly close to this topic. You've still daily, weekly got to just remind yourself and pinch yourself that we're talking about catastrophic, irreversible damage to planet Earth. So, you know, as much as we might all think, well, what's everyone doing at the weekend, and I'm going to get the new iPhone and that's all great, in 20 to 30 years, we could be talking about our children dying in more extreme weather than we're facing now. So there's a real reality check, especially when you're a parent, even if you're not a parent. But I've got 2 young children at home, you know, 11 and 8. And I'm starting to think, God, you know, when they're my age, the planet could really be totally different to what it is today. I mean, that's shocking as well. So you have to remind yourself about the consequences. On a plus side to that, and again, sort of linking to what Frank said, and what I always want to start, well, I want to start weaving this in, is behavioural science, behavioural psychology. We must be looking to other sciences to solve this problem. And I'm a big fan of behavioural science. And the reason I am is because a lot of it is around, and there's a good framework by the behavioural insight teams about making things easy. We've got to make things easy first, and accessible and social and timely, you know, to quote one framework. There are others. But I often find this is the problem. We're making things too complicated, and it doesn't need to be. And I'm hopefully here, and as are others, to make things easier, because we can do it. And I'm sure today we'll get into a bit of a discussion. I'm sure there's people on the call who are thinking, oh, God, I don't know where to start. We'll help you. The answers are already there. You know, we've known, but I think we've just made it a bit complicated. So I think there's hope at the end of and light at the end of the tunnel.
So I'll move over to Tom. So Tom, you work at Patient Knows Best. You was on the Propel Net Zero. You've got some practical examples. Obviously, your solution contributes to reducing carbon. Do you want to give us an idea of those areas that you're working in?
Yeah, of course. So I think it nicely follows on from the points that Pete and Frank have mentioned, in that if you're trying to get people to do things with the environmental impact, the kind of sole benefit, I think it becomes incredibly difficult, because there is a lack of capacity within services, because there is that workforce shortage. We know that people are living longer, their needs are more complex, the ability to treat people is increasing and ramping up, which the benefit is obviously we're able to look after more people for a longer period of time, but with fewer clinicians, fewer people available to support them. So I think what we're looking at doing is actually looking at how we can support the problems across a range of those areas. So not only delivering more environmentally friendly care, but looking at how we can reduce the financial cost associated with care delivery, how we can enable people and patients and citizens and service users to actually take a more active role in the care that they receive and focus on prevention where that's possible rather than reactive care and reactive treatment. And again, it's a bit of a no-brainer. If we're able to reduce the need for patients to attend GP appointments, to attend outpatient appointments, that's a car taken off the road. And as Frank's mentioned, 5% of the traffic in the UK is based on NHS traffic, whether that be patients going to services or clinicians going out to patients. So providing that virtual mechanism by which they can interact means that we can reduce those unnecessary trips. But I think some of the bigger savings actually come from that change in the way that patients are kind of involved and pivotal to their own health and well-being. So actually, if we're able to support patients with preventative measures, with recording their symptomatic data, their measurements, to know what that means for their health and well-being, what they need to do to prevent any deterioration, actually the impact that we can have from an environmental perspective is so much greater. So, and I apologize, and I am cheating. I've got some of these stats in front of me. I wish I could remember them all off the top of my head. But if we look at that kind of, and I know carbon accounting is the easiest way of kind of measuring it, but it's something that again feels quite accessible and is a starting point at least. But the cost of that outpatient appointment is 22 kilograms. But actually, if the bigger change that we can implement is that avoidance of an emergency department admission or an inpatient stay or a surgical procedure, actually that goes through the roof. So actually avoiding an inpatient stay is the equivalent of a transatlantic flight one way, which is huge when you think about the kind of potential there is to make those savings. So in a kind of roundabout way, the work that we've been doing is aligned with our core mission. How can we keep people healthier? How can we enable them to be more empowered and more involved in the care that they receive? How can we ensure that with such limited capacity within services, we're making the best use of that by removing those unnecessary appointments, providing those alternative mechanisms for patients to interact with their healthcare professionals, and shifting to preventative care, avoiding, as I say, those surgical procedures and those inpatient stays.
Mm-hmm. And Chris in the chat makes an interesting point. So you've obviously got your digital solution that is reducing the carbon footprint, which is great. But as an organisation that provides solutions into the NHS, obviously you've got a carbon footprint. Have you looked at things such as, like, how much server electricity you use in websites, that type of thing, which Chris mentioned?
Exactly that. So you're right. So from our perspective, there were two key focuses in terms of our environmental, without sounding too pretentious, our kind of environmental journey. So the first one was, we know that we're supporting services, and let's monitor that. And we know from 4 departments that utilise our platform out of hundreds of organisations, we're saving about 127 tonnes of carbon per year. But that's no good if actually we're, as you say, responsible for our own footprint. If we're creating a mess that outweighs that benefit, then actually that's no good to anyone. So what we've done this year, looking back on our footprint for last year, which we know is a bit of a strange year in terms of reduced travel, is looked at our own environmental footprint. So we're directly responsible for 105 tonnes. And when I say directly responsible, that includes our scope 1, 2 and 3 emissions. So we've got 105 tonnes there. So we've got a plan in place to reduce that where possible. As a company, we're remotely based. We travel on a kind of train first policy. In terms of hardware, we kind of use it till it falls over, rather than having something that is environmentally unsustainable. But we know that there's more that we can do. So we're looking at how we can further reduce that footprint, but actually in the meantime, we're also looking at how we can use permanent carbon removal, or more permanent carbon removal, to account for that entire footprint. So when it comes to those NHS organisations that we're working with, PKB as a supplier has 0 in terms of the emissions that the NHS needs to account for. So we, in effect, are committed to cleaning up our own mess. And when I say that permanent carbon removal, that's looking at things like biochar that have a permanence of 1,000 years, rather than just looking at some of those more kind of murkier offsets that are kind of easy and accessible to purchase, but in terms of their validity, in terms of their permanence, may not be there. We're also, sorry, now it sounds like I'm hopping on a soapbox, but we're also looking at investing in some of those future technologies as well. So looking at things like enhanced weathering, bio-oil as, again, that mechanism by which we can account for our own footprint. And whilst I say we've kind of looked at that for 2021, there is a continual commitment throughout the entirety of our organisation that we will continue to do that. So from last year onwards, we will continue to account for the entirety of our footprint. We'll continue to reduce where we possibly can, and anything that we can't reduce, we're going to remove, and we'll take that kind of full responsibility.
Tim, do you mind if I just come in really quickly and give a little bit of advice and support for others that might be on the call? And I mean, brilliant, and I hope people are listening to what Tom's describing, because it really is inspiring, and I think as well it'd be good to hear from Jamie in a minute as well. But organisations will be required to do this through kind of procurement legislation reasons, but don't wait till then to do it. You know, the first thing is to understand your carbon footprint. It's not that difficult, and again, you know, if anyone struggles with that, reach out to us. That's certainly, you know, the HSN can help you with some of that thinking. But the first thing is put pen to paper and understand it. There's another side to it as well, and you can tie yourself up in knots a little bit and start panicking about what to do. But you know, we need to think about, you know, creating energy and using energy is not necessarily a dirty thing. It's where that energy comes from. So, I won't talk about it now, but it's something I'm really keen on. But economic growth is so vitally important to health and well-being, so we can't lose sight of that as well. So we need good, sustainable use of our resources. But well done, Tim, and I hope people on the call are inspired by you and want to take them steps too.
Okay, we'll move on to Eva. So you work at Dignio, originally based in Norway, which is not only physically green, I'd say is probably seen as a sort of a green country that's sort of leading the way. So you provide a remote monitoring solution. So what lessons could we take from your organisation or your territory into our into our NHS?
I think as a headline opener, Norway as a country is obviously very committed to environmental standards, and despite being very oil wealthy, there is a great focus on renewables and harnessing the power of renewables, but also establishing relationships with countries beyond Norway to have a sustainable and reliable supply of renewable sourced energy. So the sort of stories that we hear that we cannot rely on renewables because the supply is intermittent, that becomes the story of the past. So Norway as a country is certainly committed to environmental standards, looking at increasing the renewables as the main source of energy supply. When it comes to healthcare, shamefully, we need to, well, I'm not Norwegian, so Norwegian healthcare system lags a little bit behind and is very much looking towards the NHS. And this is where the NHS is, again, a world-leading healthcare provider, leading on the green agenda and actually creating not only tangible standards to which suppliers are being held and to which healthcare providers are being held, but also actually putting investment into setting up structures that support the transformation and thinking about green as a business as usual, not as Frank and as Tom and as Pete mentioned, something additional, some burden that is going to impose additional costs, but rather thinking about it, this is it. And as a parent of an asthmatic child, I could see the difference between lockdown and traffic after lockdown. And to realize that part of the traffic going past my house, causing my child to have exacerbation, is actually caused by the very healthcare providers that are then going to have to look after her and have the A&E admission and have to process her at very high cost to the system. That is, it just stops you in your tracks. And that really compelled us to apply for the Propel Net Zero Accelerator and be really serious about the conversation about the green impact of how healthcare is delivered, how the models of delivering healthcare are constructed, and the impact of the supply chain. As a supplier ourselves, we look very carefully, we provide software and hardware. So for us, obviously, there's the impact of manufacturing software, there's the impact of consumption of that software, but there's also the impact of hardware and how that hardware is present within the healthcare system. So as a supplier, we have taken a decision to provide a complete service delivery where we can control which bits of hardware we integrate into our solution, to focus on design durability and reusability, to control the waste process, which is very important, and to control the complete life cycle of every hardware piece that we give out to the patients to use. And also to control the consumption of the resources for patient support, so we can look at how we can optimize that process. But for us, very much like for Tom's solution, it's about preventing deterioration. And what Norway does a little bit differently than the UK is the slightly less fragmentation within the primary care, where the primary care and social care are a little bit better connected. The impact of that is that people stay longer in their own home. They stay healthy for longer, they stay active. And the knock-on effect of that is that you avoid deterioration, you avoid the need for the large number of hospital beds, you avoid the need for large number of residential care settings, with the problems of then those residential care settings very often generating the ambulance conveyances, for example, which can be avoidable and can drive really high carbon impact. So there are all different ways of changing the ways SMEs do things. But what I really liked in Pete's comment is it's about what we can do today. It's not about getting ourselves in knots and twists and sort of thinking big vision, big costs, big, what do? I have to completely revamp my operation. No, it's about looking at what you do today and what you can do differently. So for us, one of the smallest steps we take is encouraging our employees to A, not travel unless necessary, so very much hybrid working, and B, if you need to travel, get an electric car, because that's sort of, if you really have to travel, try to make as small an impact as possible in terms of pollution levels you're creating. Of course, tires are still present on electric cars. So all those sort of, large particles that have impact not just on the oceans, but onto the neighborhoods where people inhale those things. That's something we can all start contributing. So for us as a small, medium enterprise, it's about looking at what we can do today, small steps, and having this really frank conversations with everyone we interact with about looking at this aspect, because it's those sort of ongoing conversations and keeping this at the forefront of people's minds and showing them that even as a small company, you can really make a difference. And looking at your supply chains, a bit out of our control, but doing as much as we can is really, really important that we all do this together. So that voice becomes stronger and reverberates rather than just goes, oh, it's just some visionary, oh, it's going to be expensive, etc. Mm-hmm. So that's my 5 pence piece here.
No, that sounds really good. And I think, definitely a key theme is looking at practical ways that you can address it and not get entangled up in the weeds of, what you can do. So that sounds really, really encouraging. So we'll move on to Jamie. So Jamie, you work at Dickinson. You support health tech suppliers across with their journey. What's your take on the climate agenda in the NHS?
Thanks, Tim. Well, you won't be surprised to hear me say that it's pretty similar to what we've heard from everybody else so far. It feels like it is very much a here and now issue. It's not something that is kind of abstract to be considered in the future, looking at a target that is many decades away. We have to address this now. I think the most interesting examples, to echo what Eva was saying, the most interesting examples are very practical examples that grab people's attention. Things like, for example, I'm sure many of you will have heard of this, heard David Lawson at Guy's and St Thomas's speak about it, but how they changed their supply chain arrangements so that lots of their supplies to the hospitals come up the River Thames, rather than being driven in by lorry. And once they arrive on the edge of the Thames, they're then taken by electric bikes into the hospital. Great idea. It's the kind of thing that people can really understand. It talks to the travel aspect, talks to the seas aspect that we mentioned earlier on as well. So I think it's those kind of things that we need to highlight more and more, because they grab people's attention. Now, digital and health tech is obviously key to dealing with the challenge. We've already talked about the fact that this is not straightforwardly the case that there is no cost in doing everything remotely, for example, consultations and monitoring. There are energy costs, IT infrastructure, costs a lot in terms of carbon emissions, and we need to factor that in. But I think at least now we are having that conversation, and there's a mature conversation about that. So that's good. Clearly, things are only going in one direction. There's going to be more and more digitization, use of technology in the NHS, and that's a good thing. I think just to touch on some of the things we see as lawyers, and you may be wondering perhaps why a lawyer is even on this call. And again, it comes down to the practicalities of this, because our clients come to us and they say they're getting pressure from all sides. They get pressure from investors, they get pressures from regulators, they get pressure from funders and commissioners, they get pressures from customers and patients wanting to know what they're doing about this agenda. So they know they need to do something, but they often come to us and say, well, what do we actually have to do? We know it's a good thing as a moral imperative that we address the green challenge, but legally, what do we have to do? How is this actually relevant? And I think, we now are able to say to them, there are concrete things you need to be aware of. So just to sort of run through those briefly, there are some general things out there in the commercial world that people need to be aware of. So investors and financial reporting requirements for ESG generally are a major thing now. Lots of people will be aware of that. There are some particular things which are starting to come up, like, for example, the directors of Shell were sued for breach of their statutory duties as company directors under the Company Act for not adequately taking account of net zero targets. That introduced a very interesting element where directors of companies could be sued for what they're doing around this in their business. Greenwashing is something that's becoming more and more relevant. Every other company under the sun now starts to say something about green, but is it actually true? The CMA, which regulates and protects consumers, is starting to look at this very seriously, and companies will get into trouble if they start greenwashing in a very obvious way. So those are sort of general things that are already happening. I think in healthcare and the NHS, there are even some more specific things. So the new Health and Care Act, which came into force in July, has some specific legal duties on NHS bodies for them to consider climate change effects when discharging their duties. Now, if you are an integrated care board or a hospital and you are having to comply with these legal duties, one of the things you'll have to do is pass that down to the organisations you contract with. So all kinds of contracts awarded by NHS bodies now include specific things around compliance with climate change targets. And that's not just specific to the NHS. We're seeing that in the wider government sector. There's something called the model services contract, which is a big template contract the government uses for big IT contracts, for example. That's starting to get much more prescriptive about what contracts have to do. And you see it in all sorts of other contracts as well. We're starting to see contracts where suppliers are asked, for example, to reduce the amount of goods they bring into the country by air by, say, 5% in a 2-year period. So things are becoming very specific and prescriptive. This is no longer a kind of airy-fairy, nice to have, we can consider this in a few years kind of thing. This is becoming very here and now from a legal perspective. And the biggest issue is procurement, which has already been raised. So the NHS supply chain accounts for about 60% of carbon emissions in the NHS, I think, at the last count. And public procurement rules are a way of leveraging climate change improvements. So we've started to see some initiatives that were in the wider government sector feeding into the NHS. So as someone's already mentioned on the call, 10% of evaluation criteria are now focused on social value, and that has environmental elements in that. The next thing down the track from April next year, any contracts awarded over £5 million in the NHS will require production of a carbon reduction plan. And the year after that, 2024, that will become a requirement for any contract of any value at all. So what we're moving to through the Greener NHS net zero supply roadmap and Project Evergreen is a process where by 2030 you will not be able to bid for and hold an NHS contract, whether you're the most fantastic health tech innovator in the world or not. You're not going to be able to hold a contract unless you've got a carbon reduction plan and you are able to report on how you're delivering it. So again, it's here and now. These are public procurement rules that anybody wanting to get a contract with the NHS needs to be aware of. And the final thing I'd just mention is the regulatory environment. So as we move away from single-use plastics, as we move towards more remanufacturing rather than simple recycling of products, the regulations that govern medical devices have to be looked at to see whether that's actually permitted. And it's not always straightforward to say that it is. And there are vested interests in some sectors in making sure that those rules don't change. So that's another area where we're starting to see some legal issues. So hopefully that just gives you a flavour of the fact that actually for anybody looking to deliver goods and services in the healthcare sector and to the NHS, for health tech innovators, there are some really concrete things that are worth being aware of from a legal perspective that will help you. And frankly, if you get on top of these now, will give you a competitive advantage and help you to win contracts. So the work we do is very much supporting innovators in that way.
Mm-hmm. That's a great insight there, Jamie. Thanks for that. Frank, you've got your hand up.
Yeah, thanks, Tim. I just wanted to share a reflection really based on what Jamie was saying. So I was at a sustainable pharmacy conference a couple of weeks ago, and it was really interesting. I noticed a sea change in the understanding and the engagement around sustainability from the big global pharma companies. And one of the things that really made my heart sing actually was that they weren't talking about competitive advantage or keeping their data secret. What they were calling for was total transparency around their carbon footprinting methodology, and that they wanted that transparency in order that comparisons between their product and a competitor's product were meaningful, and in order that they would be to some degree protected from accusations of greenwashing. It felt like a really sort of forward-thinking, mature conversation in a way that it's not my area of expertise, but from what I've heard from talking to pharma in the past, years ago, this was a very different conversation.
Yeah, it's interesting that, Frank. Eva, you've got your hand up, and I know you wanted to discuss medication.
I just wanted to allude, because I had the pharma. Sorry, I just at the same time I started replying to accessibility question, which I will just erase my answer and go back to it in a moment. So one example which I can share from Norway about the medication compliance, it's about reducing waste in medication and titrating medication according to the actual patient needs, and avoiding this polypharmacy, persistent polypharmacy, where a person gets prescribed a medication 10 years ago and 10 years later they're still on the same thing with other things being added alongside until they forget to take all of them. You have all the packaging from the medication being discarded in domestic waste, completely uncontrolled, and medication going out of date, sitting in people's cupboards. It's utter waste. So what Norway has set up, and that requires an infrastructure to be set up, we have a hardware solution which allows for multiple dose dispenser, which basically means that people get given, by the time the medication hits their home, they have the dosage as prescribed, they take it at the time when they should, and there's no wastage. And the whole sort of control of how the medication is uploaded into the packaging that goes into patient's home is done in another infrastructure. But in order to make this kind of hardware available in the UK market, you need the infrastructure, you need the contracting, you need the procurement, you need the capabilities of the local community pharmacies or the services to be able to fill those strips. We don't have that in the UK at the moment. And I strongly believe that the way the medication is currently dispensed, prescribed, dispensed, recalled, is not optimal. And that requires a sea change in thinking about what happens to the actual medication that goes to patients, how much of it was wasted, how much of it is unnecessary, and having a better control on how it travels between prescription point and the patient actually taking it. So that's one example which I can share where there is an infrastructure, it works. It could be something that could be looked at to see whether that is something that is feasible for the UK as well.
Mm-hmm. And Eva, did you? So generally speaking, obviously there's an issue in terms of medication not being taken and overusage and what have you. Did you find that? Did you have that in Norway, and you coupled the climate agenda to it to sort of drive that? Because there's probably pockets of problems we have where actually, if you address some of the climate things around it, it actually supports that.
We haven't actually analysed the impact of the medication compliance intervention and, to what extent the optimization of how medication is dispensed and used by the patients in comparison to the more traditional way, to what extent it offers savings in terms of green impact. So it's certainly something we'll have a look at. Thank you.
Yeah, sounds good. Pete, you've got your hand up.
Thanks. Yeah, just while we're on medicines, because it's an area that I'm involved in. Again, what Eva's just said as well. There's digital solutions already there to help these problems, but we just need to get under the skin a bit more of why we can't do that right now. And I think you've alluded to a couple, like the infrastructure. As I said right at the beginning, behavioural science really interests me. I think there's a behavioural science methodology that we can apply to medicines waste and adherence. I'm doing some work with the Sustainable Medicines Partnership, and they're actually leading that work. We're just part of that partnership where we're quantifying the carbon impact of every medicine that's going. We need to understand at a granular level, and people do need to understand what that impact is as well. And as I said, some nudge theory type of approaches to help. And one podcast I was listening to this week said, if you and I don't know if this is practical, but it's just it's a good example. But if you give people 20 pills and make 15 of them one colour and 5 another, and say you must take the 5 when you've taken the 15, they will take all of those pills, because it's called, I can't remember the exact phrase, but it's like psychological segmentation. And so sometimes, we're not applying some basic principles that could help us, but absolutely know that wasted medication is a problem, the packaging that it comes in is a problem, and there are solutions. So we just need to keep on teasing this really and want to do something about it. So it's a good topic.
Yeah, that's so we've been going an hour. If anyone's got any questions, feel free to put them into the chat. I know there's been some narrative and some discussions which has sort of influenced it. I think, there is some sort of areas which are outside of our control, which Jim's mentioned, especially in terms of the invasion with Ukraine. There's a lot of things, and like you say, from the conversations, it's how do you sort of demystify that and keep focus. Okay, so I'm just thinking, so I've got some quick fire questions for the panel. So we'll run through these. As I say, if anyone got any other points or questions, feel free to fire them in. So the question is, have you got, and you've mentioned a couple, but if there's any others, bring them to life. So have you got a practical example of how you've supported the green agenda? So something practical, maybe something that you didn't think of, but actually materialized and contributed to that. Okay, so we'll go through the list. So let's start with Tom.
So I think there's a good example of us doing that, and as I said kind of earlier, that kind of alignment with work that we were already underway with. So looking at, again, how we can support services and having that better interaction with patients. And I think it was only when we started working with the Sustainable Healthcare Coalition and the Yorkshire Humber HSN that we even considered the environmental impact of that side of what we do. So I think that for us was a kind of perfect accident in all honesty. So the things that we were already doing, the kind of direction that we were already pushing people in, was already doing the right thing for patients, for clinicians, for services, for the finances of the NHS, and then the environment. So I think that would be the accidental thing that we kind of stumbled into, was actually looking at the work that we were already doing with that environmental lens and using that as a starting point. So yeah, as I said, we were fortunate that the thing that we were doing, the thing that we were driving, the way that we were set up as an organisation in terms of being completely remotely based, there was a lot of things that we were already doing because of the wider impacts and the wider benefits that we were receiving from them, and then looking at them with an environmental lens actually only kind of magnified the benefits that we were achieving and delivering.
Mm-hmm. Yeah, that sounds quite reassuring that, you know, there's already things afoot. It's just you haven't looked at it from that perspective.
Exactly, and it's been good to kind of highlight where we can improve. But I think that's the key area for me. That is, if you can bring people along on that journey of looking at what we can do to do things better, and there's additional benefits. If you're hitting a whole range of benefits rather than it just being kind of siloed and just focusing on the environmental benefits, I think that's where we're going to see the best traction. So it's seeing this as an additional thing to further support services, having the environment as one of kind of multiple benefits that are available.
Mm-hmm. That's great. Thanks, Tom. Frank, have you got any practical example or anything that comes to mind?
So yeah, I wanted to talk briefly about anaesthetic gases, and without getting into the real nuts and bolts of it, there are, I'm oversimplifying, but there are essentially 2 readily available anaesthetic vapours available in every anaesthetic room in the UK, pretty much. And for 10 years, we've known that one of them has a greenhouse gas potential on a clinically equivalent basis, which is 70 times greater than the other one. And the one with the awful environmental impact costs more money. And there is 0 clinical difference in patient outcome. So we've been talking about this for 10 years. And I suppose my point in telling this story is that sometimes things just need to be right place, right time. And I know Pete's good on nudges and all that sort of thing. So I've been talking about this for 10 years and nothing had happened. And then in the last 12 months, every hospital in West Yorkshire has reduced its use of the environmentally damaging vapour to approximating 0. You know, orders of magnitude reduction in use, because all of a sudden it was what the anaesthetists wanted to hear, and the alternative was made readily available. There was a big push and it happened overnight. So I suppose it is worth continuing to push against those closed doors and keep building your arguments and bringing your colleagues with you, because eventually tipping points are reached and huge change can happen very quickly.
Mm-hmm. Yeah, that's a really good example, and from outside that just makes sense, you know. Eva, have you got any example of sort of practical areas?
I think for us the most practical is, you know, alluding to Tom, obviously the use of our solution has similar impacts. And one of the virtual wards that we run in north of England is high intensity users. So people who would dial out 999 as the default, I need attention from healthcare, social care, or whoever. And the moment the first ambulance journey is prevented, because that person is handled a little bit differently and supported on their journey to recover from this dependency on dialing 999, then the savings accrue with the immediate impact of no ambulances being sent out. Secondly, the more on the company level, the more practical step we've taken. When I really love this about the social spaces, and very much, Frank, looking forward to seeing the evaluation. We told our employees to take a walk, because I personally am a great believer in the power of nature and the importance of switching off, especially for the mental health and well-being of everyone, but particularly when you are during your working day. So we told people to just go out and take a walk somewhere green. And obviously we're not congregating them come to this point, because it just means an additional unnecessary journey. Just nearby, go somewhere every single day. And that's our very small practical step, which supports our employee well-being, supports their mental health agenda, and also supports the fact that green does work. Green spaces are really essential to human well-being. So that's it. And I can see there's some question about combining medication compliance with an app. That is exactly what we've got. So our medication compliance is not just giving people hardware that will buzz, it's wrapped around. And Pete, when you talk about behavioral change, it's extremely important. When you want to change the way people do things, You need to do it slowly. The nudge theory. I love positive psychology. It's not about bashing people, frightening them, or punishing them. It's about telling them this can be better for all of us, and showing them the positive side of things. And doing this journey that we've alluded to, that, if we all on the same journey and keep it at the forefront of people's minds, and this becomes easy, then everyone will kind of follow.
That's a great example, and linking it to health and well-being and employer and whatever. Have you got anything to add to that, Pete? I know you're a firm ambassador, especially when I see pictures of you at 7 a.m. walking in the forest and what have you.
No, yeah, there's a couple. Again, I should maybe be on commission for behavioural science. It's good to hear that people agree. And if you haven't checked it out, check out the East framework by the Behavioural Insights team. I'm going to name it the Tim East framework from now on. But someone put a question: why don't things get done? But the East framework gives us the answers. The reason the things don't get done is because we haven't made it easy, accessible, social, and timely. And Frank's example there was it wasn't timely. But the actual thing was easy to do. So brilliant, but check it out. In terms of what I've done, I mean, there's a couple of examples, but I'm going to give one hot off the press. I have pulled together a resource to make it easy to work out how to create a carbon reduction plan and to put it together. And as an HSM, we're going to be working with our suppliers that we think have got something to contribute to net zero in the first instance. So I've done a bit of a horizon scan. But I'm sure we'll connect with others as well. So I really want to hand it on a plate to suppliers. I'm going to do a briefing session this side of Christmas. Get a carbon reduction plan, as I kept saying, and why I thought it was brilliant what Tom was alluding to. If you try and, well, I'm not saying you might already have one, but if you try and look at the information about how to do one on the internet, you can tie yourself in knots. So I've kind of done that tying in knots for you and made it simple. And I think we can do some really good carbon reduction plans. And if we could turn around out, this is my ambition. I would love to say 100. I mean, I'm making numbers up now. I'd like to see loads. But if I could say we've got 100 companies that the HSN are working with that have all got a carbon reduction plan and know what their carbon impact is and got some targets, that would be brilliant. And if that 100 companies could be 200, 300, 500, whatever it might be. So that's what I've done this week. So hot off the press.
No, it sounds good. Getting a KPI link to that and get the organisation focused. Eva, you've got your hand up.
Indeed, I do. Peter, I'll definitely will be following up with you on that one. But also, I just wanted to mention that I keep on getting emails from the Crown Commercial Services offering a free review service for carbon reduction plans from companies if it's submitted for the review. And I think it's a valuable service. Otherwise, one falls sort of, into this knots and twists and knots and worrying about, am I doing the right thing? So there are all kinds of sources of support available out there for companies that are willing to take them.
Yeah, so sounds good that. And Jamie, obviously we won't hold you to anything you say, but have you got any examples of good practice?
Going for a walk is definitely a great practical example. I like that a lot. A couple of things. So we realised that we needed to follow up our words with action. So we have recruited and appointed a sustainability lead to help us with our own carbon reduction plans and to make sure that we are delivering on that as a big business. And the second thing is something we haven't done yet, but we are hoping to do, which is be part of a support program to businesses looking to work with the NHS and in the healthcare sector generally to help disseminate knowledge through a series of programs. So yeah, very much want to continue to support this agenda.
That sounds good. And there's a door open for you there, Jamie. We've got a sustainability masterclass, which you're more than welcome to come and speak to the cohort for Propel, which I'll speak to you offline on.
Brilliant. Yeah, thank you.
David on the chat, he's got a question for Frank. So what were the key barriers to not swapping the gases over earlier? Or asked in no other way, was it a key driver that enabled the swap to occur?
Yeah, thanks, Tim. I've put a response in the chat. I think the really big one was culture. It's perhaps a lecture for another day, but doctors in the NHS don't like being told what to do, and they don't like having options taken away from them. They feel like that's a reduction in their liberty, a reduction in their freedoms, and there is a I might be burned at dawn for this, but there is a perception of autonomy amongst doctors and consultants in the NHS. It's a perception, I believe, but people hold on to it very, very strongly. And so there was a lot of bizarre conversations. Oh, I know what the data says. I know what the peer-reviewed evidence is, but I know my patients better. Which, you know, you don't need very much of an understanding of science to understand what a nonsense that is to say. But I heard it. And so what I'm not clear on is what caused the absolute tipping point. I think there'd been a groundswell for several years. I think that the next generation of doctors are much more clued up on climate change and much more worried about climate change than the current establishment. But we don't have time to wait for all those retirements to usher in a new era. I think that we did manage to get a fellow in sustainable anaesthesia for a year funded, and Lucy Brooks was her name, and she did amazing work across the whole of Yorkshire and Humber, understanding what was happening in different hospitals, speaking to individuals, explaining to them what was happening and why it was important, really spelling it out. And then, of course, once one hospital stopped buying the environmentally damaging vapour, she had a great leverage then to, you know, speak to all the others and say, well, St Elsewhere's has stopped buying it. You don't want to be left behind, do you? And there was a definite domino effect. There are still one or two significant outliers. You know, the work is not done, but across Yorkshire and Humber, but we made great progress very quickly. And I'm not quite sure what exactly that seed was that started the crystallization.
And Dina, has the supplier changed their product to so that they are, or are they still?
The problem with the product is its chemical structure.
Right. Okay. Right.
It's a direct. It's a direct effect of that chemical, which is currently vented out the top of the hospital into the atmosphere. They have put forward a solution, which is to capture the vapour before it's vented out the top of the hospital. I have very significant misgivings about both the efficiency and the business model and the legislation around that solution. I'm being quite careful with my wording.
That makes sense. And it's interesting you mentioned culture, Frank. So there's a phrase that really resonates with me, and that you probably heard it in terms of culture eats strategy for breakfast. You know, and it can be seen as a big blocker to sort of drive change over. Okay,
I've got the scars and the grey hair to prove it.
Yeah. Okay, so that brings us towards the end. What I will do is, though, if there's any other key topics that any of the panel members want to bring up, feel free to bring those up now. If anyone on the call's got any follow-on questions or points, feel free to put them in the chat. There's definitely evidence of time flies when you're having fun. So, Pete, you've got your hand up.
I'll mention one. I mean, I'm sure there's lots, but this one's just played in my head and always does. But biodiversity, nature-based solutions. I would love society to invest in green infrastructure. Every hospital, every building in our cities should have a green wall and roof on them. Now, that wouldn't be cheap, but to create that, what we'd be doing is creating jobs. We'd be creating jobs for the infrastructure that's needed to hold the green walls and roofs in place. We'd be creating jobs for maintaining those green walls and roofs. We'd be having a massive mental, physical well-being impact on the people that walk past those buildings, approach those buildings. The air pollution would be absorbed into those buildings. There's great evidence for that. And we know that we need to have nature as part of the solution. So loads of things I'd love to do, but I just think we've got to start creating a narrative where we talk economic growth, green infrastructure, because we will solve the problems that we're trying to solve.
That's a great finish conclusion, Pete. Eva, you got your hand up.
That's just going to sound a little bit glib, but I was thinking about something else, not connected, but the phrase that came to my mind, that basically there's no health without wealth, and there's no wealth without health. Because if you've got unhealthy, unfit, mentally disturbed workforce that cannot be upskilled, you will not be generating the kind of high-skilled economy that we keep on hearing about. If you've got sufficient economic income resources, you can invest in this transformation of healthcare that needs to be undertaken. Otherwise, we're all on the way to sort of a really challenged healthcare system. So I think this very secular, there's no health without wealth, and there's no wealth without health. That is something that we just need to hammer until the message sinks in, because the two are intimately connected, and one cannot exist without the other.
Mm-hmm. Yeah, really valid point, that, Eva. Thanks for that. So we'll bring the session to a close. I hope you found it useful. I've definitely found it useful. I think from the panel members, we're on that road. At least we're on that road moving forward. We've had some great examples of how we're contributing to the green agenda. I think suppliers may be actually surprised once they start focusing on it that actually they are doing things. So I'd like to thank the panel members for attending and their input. As I say, we'll record the session, and yeah, thanks for your time. If the panel members want to stay on for a moment.